What is the most popular remedy among our people, especially among grandmothers and grandfathers, for stress, anxiety, restlessness, and insomnia? Of course, it's Corvalol or Valocordin. In this video, I'll tell you that this is not a simple and sometimes even dangerous medication. And if you use it incorrectly, it can do more harm than good. And if you watch this video until the end, you'll find out that there is a type of Corvalol that is safe for most of the problems I'll be talking about in this video. Let's make it clear right away that Corvalol is contraindicated for chronic insomnia. And this is actually one of the most common reasons why people, especially older adults, take it. Let's figure out what Corvalol is. The main active ingredient in Corvalol is phenobarbital. By the way, as a drug, phenobarbital is strictly regulated because it's a powerful substance that really causes serious side effects. We'll talk about that later. But in a medication like Corvalol, phenobarbital is present, yet for some reason it's not specially regulated. Why? If we take drops, well, everything in Corvalol is measured in drops, and it's considered that the effective dose is about 30 drops, well, 30 to 40 drops. So let's do the math. 30 drops is 1 milliliter, and in 1 milliliter of Corvalol there are 18 milligrams of phenobarbital. Remember, 18 milligrams. And the effective dosage, if we're talking specifically about phenobarbital tablets, is 100 milligrams. So it turns out that the dosage of phenobarbital in 30 drops of Corvalol is 5 times less than in one tablet that contains 100 milligrams of phenobarbital. And in general, in this sense, we can say that this dose is quite safe. That is, it is unlikely to cause any serious side effects. However, I want to say that if we look at the doses that already have a harmful effect, 1 gram, which is 1000 milligrams of phenobarbital, can already cause serious poisoning, and 3, 5, or 10 grams is already a lethal dose of phenobarbital. That is, there is still a rather narrow therapeutic threshold between the dose at which we can get some therapeutic effect, and if we significantly overdose, getting a toxic effect. And now let's see how Corvalol is used. Well, okay, if, let's say, a person got nervous and took 30 drops or even 50 drops of Corvalol, nothing critical will happen. But what happens with elderly people? Let's say a person isn't sleeping well and decides, I'll take some Corvalol. He pours himself 30 or 40 drops and drinks it. That dose won't immediately cause someone to fall asleep. Because, once again, the hypnotic dose of phenobarbital is 100 milligrams. That means you would have to pour about 150 drops of Corvalol. Of course, I'm not encouraging you to use that many drops at once, but in fact, if we look at the guidelines, it says that 100 milligrams of phenobarbital produces a hypnotic effect. But a person only takes 18, maybe 20 to 25 milligrams of phenobarbital in 30 to 40 drops of Corvalol, and naturally, they can't fall asleep. So what does the person do then? They repeat the dose. Moreover, elderly people have what's called the Ribot's law. It's when a person remembers what happened 20 or 30 years ago but can barely recall what happened 5, 10 or 15 minutes ago. An elderly person takes 30 drops of Corvalol, waits 15 minutes without falling asleep, then forgetting they already took it, takes another 30 to 40 drops, still unable to fall asleep. And so by morning the bottle might be empty, and a 25 milliliter bottle of Corvalol or Valocordin contains 450 milligrams of phenobarbital. That is, this is already a dose that is close to toxic, and a person can actually get poisoned. With confusion, with falls, with fractures, and so on and so on. Dementia develops, a type of pseudo-dementia, where the person's thinking becomes unclear. And if a person drinks large enough doses, it is known that within 6 to 8 weeks, a severe physical dependence develops. That means the person can no longer go without using, because if they don't, their mood suddenly worsens, their blood pressure starts to fluctuate, and they can even develop seizures. In other words, classic withdrawal syndrome. If there are such patients who frequently use these drugs and they need to be taken off them, then the person actually needs to be hospitalized, so that in a specialized addiction clinic, they can discontinue the phenobarbital-containing drugs under supervision. So you need to understand that the chronic use of Corvalol or Valocordin is a very dangerous situation, which leads to a lot of side effects and the phenomenon of dependence. Ultimately, there will be no effect on insomnia. In fact, at some point, the person's sleep will actually worsen. So, dear friends, be very careful when using Corvalol or Valocordin, which contain phenobarbital.
Roman, why is it in general so wildly popular? Because even people who don't use it have definitely heard about it. And is Corvalol always associated with grandmothers?
Listen, well, first of all, it was popularized by the healthcare system itself. Well, I mean, doctors also said something like, here, take some Corvalol. On one hand, it seems like a strong medication, but on the other hand, you don't need a special prescription for it. To obtain phenobarbital tablets, a special prescription is required. Attempt to locate and purchase them. And this perhaps is poured like water for old ladies. Moreover, I want to say that in most countries, Corvalol and Valocordin are banned. And it's even known that if you cross the border with this little bottle and, excuse me, you get caught at the border, they'll say you're carrying drugs. Well, or you must have the appropriate prescription that the doctor gave you, but usually people buy it without a prescription. And then try to explain to Bojenik what you're doing there. Are you sick and getting treatment, or are you transporting drugs across the border? Well, and the next thing is the development of addiction. Listen, the more people take a drug that causes addiction, the more users of that drug there will be. If you also, so to speak, associate the specific smell of Corvalol with your older generations, give this video a like. As I already said, it's not advisable to treat chronic, especially insomnia, with phenobarbital-containing drugs like Corvalol or, for example, Valocordin. And moreover, I want to say that the most effective method for treating chronic insomnia is not pills. At the moment, it's a cognitive behavioral therapy for insomnia, which has an evidence level of A in almost all clinical guidelines worldwide. That is, if you use this method, it reliably works and helps patients. And I implement a cognitive behavioral therapy program for insomnia, and in a month and a half, I cure most patients with chronic insomnia without medication. If you suffer from chronic insomnia and want to get rid of it, please contact me. I can help you effectively by using a cognitive behavioral therapy program for insomnia. You can find my program by following the link in the description of this video. I promise to tell you which Corvalol is not dangerous in terms of use and the side effects of phenobarbital. So, there is Corvalol Phyto, which does not contain phenobarbital. It has other substances that also have a calming effect, and there are corresponding herbal components. And in terms of taste and smell, it's exactly the same as regular Corvalol. And especially grandmothers and grandfathers who already get a kind of placebo effect, when they take it and smell that scent, they should start feeling better, and they do feel better. So try to replace regular Corvalol with Corvalol Phyto and see. It's quite possible that your older relatives will easily switch to this new Corvalol Phyto. They will experience the normal effect, but at the same time, this will minimize the risk of complications associated with the use of phenobarbital. And what medications do you use to deal with insomnia? Write in the comments to this video, and maybe I'll discuss with you whether they're good or if there might be some better medications. Although, of course, I should say that any prescription should be made by your doctor. But I think that people who especially suffer from chronic insomnia should have complete information about the medications used to treat insomnia. To learn more information about the specific medication, please write as well. Maybe in the next videos I will review this medication. In general, let's understand that there are no completely safe medications. You know how people say, please give me a very strong but safe medication for insomnia. There are no such medications. The stronger the medication, the more potential side effects it may have. And when a medication is absolutely safe, well, usually it's absolutely useless. So, it's a double-edged sword. And when we prescribe a medication, we always weigh the benefits and the risks. But still, my main approach is that before I prescribe any medication, I first help the person normalize their lifestyle, conduct an examination, identify possible other causes of insomnia, and address them accordingly. And only after that, if possible, I implement a cognitive behavioral therapy program. And if that doesn't help, then I prescribe medication. For me, taking sleeping pills is a last resort, not something you do casually just to fall asleep quickly. As a rule, you can't really cure insomnia with just a pill. So, if you want to take a smarter approach to treating insomnia yourself, watch my channel. Here you'll find a lot of useful and interesting videos about treating insomnia, including both medication-based and non-medication methods. And click the bell so you don't miss my newest and most interesting videos.